Hey guys, it's Dr. Dan Choi here, and welcome back to my channel. Today I'm going to be doing a reaction video on the movie Contagion. A lot of my friends have recommended this movie, saying that you have to watch this. It's predicted this COVID-19 pandemic just the way it's happening, and I need to see it for myself. So before we get started, I wanted to ask you a favor. Please smash that like button below, and if you don't want to miss any future reaction videos from me or any future COVID-19 videos, please hit subscribe and also hit the bell notification as well. Let's get started. So this looks pretty ominous. This patient is clearly diaphoretic, which also means he's sweating profusely, he is unwell, and presumably has the virus that this movie is going to be about. He's on a train, he's on a plane, spreading it to everyone around him, and he's heading into this major city, Tokyo, with 36 million people. This does not look good. Let's see what happens.
Do you have a history of seizures?
No.
Allergies, other medical problems?
I think she's allergic
fall
to
recently?
penicillin.
Did her head in the
No.
shower?
She came back from a trip and she
What about
was,
drugs? MDMA? Ecstasy?
No, we don't do that.
Okay, let's
Jesus,
get some help.
So unfortunately here, Matt Damon's wife looks like she's having a seizure. So she has the virus. It appears that this virus is having some type of neurological manifestations. And in her case, if it's causing a seizure, then it may be related to a viral encephalitis, which is an inflammation of the brain that's caused by a virus. Here you can see that the ER doctor is asking Matt Damon about other questions that are unrelated to viral symptoms, such as, did she fall? Is she taking drugs, which I guess are higher up on the differential diagnosis as causes of seizure. And one of the most challenging parts of an outbreak like this is at the beginning, nobody really knows that an outbreak is happening, so they're not asking about it. And so that's how the virus can be spread pretty quickly.
What we are hearing from Beijing is that the outbreak is contained to the Chrysanthemum complex in Hong Kong. 2 deaths and 10 suspected cases.
How are we defining contained?
Wow. So I still remember back in January when there was a mystery virus in Wuhan, China that was apparently contained. Look at this news report from back in January.
We're going to begin here with the outbreak of a mystery virus in China that now has the World Health Organization on edge. At least 4 people have died and hundreds more are sick.
Now, at that point, the world was hoping that China would contain this virus, but unfortunately it didn't.
They're using the same protocols established for SARS. They're quarantining the complex and screening for symptoms.
Kowloon is the most densely populated area in the world, and Hong Kong is a harbor. It's going to spread.
So SARS stands for Severe Acute Respiratory Syndrome, and this was actually an outbreak that occurred back in February of 2003, started in China and spread to 12 countries around the world. So fortunately it was not as widespread. It was just over 8,000 cases and about 775 deaths. This was also caused by a novel coronavirus, similar to COVID-19. And back then the virus name was SARS-CoV. And the current COVID-19 outbreak is actually caused by coronavirus as well, and that has been labeled SARS-CoV-2, the second novel coronavirus that we know about. And fortunately, as Laurence Fishburn mentioned here, the CDC and WHO were able to use different tactics and measures to contain the spread of SARS.
The average person touches their face 2,000 or 3,000 times a day.
2,000 or 3,000 times a day?
3 to 5 times every waking minute. In between, we're touching doorknobs, water fountains, elevator buttons, and each other. We call that number.
Honestly, guys, touching my face has been the hardest thing to stop doing during this pandemic for me. If you've also struggled, let me know down below. It's so subconscious, it's hard to realize that you're actually doing it. And actually wearing a mask for me helps me prevent myself from touching my nose and my mouth. So at least the mask is helpful in that way for me.
The R naught. R stands for the reproductive rate of the virus.
Any ideas what that might be for this?
How fast it multiplies depends on a variety of factors. The incubation period, how long a person is contagious. Sometimes People can be contagious without even having symptoms.
You were going to plan it. Can't think of a better time than Thanksgiving.
So, interestingly enough, the R naught has been talked about by COVID-19 experts all over. And back in January, there was a Harvard epidemiologist. His name was Eric Fagel-Ding. And he sent out a tweet based on a study that the R naught of COVID-19 was 3.8 and was raising the alarm bells because this was so much higher than the R naught of the seasonal flu, which is around 1.2. The 1918 Spanish flu pandemic was somewhere around 1.8. So this was significantly higher, meaning that it was really going to spread around the world pretty quickly. Dr. Fagel-Ding actually got a lot of heat for raising the alarms back in January, and now we've seen that this virus has spread very quickly. The experts still don't know the true R naught of COVID-19. They're studying that carefully now.
Government officials are reporting the closing of Mondale Elementary School in suburban Minneapolis in response to the recent outbreak of a still unknown disease that has so far taken the life of a school nurse and 3 students.
So school closings have definitely been part of the strategy to implement effective social distancing. So this movie definitely got that right.
We have a novel virus with a mortality rate in the low 20s, no treatment protocol, and no vaccine at this time.
That is correct.
This scene is actually pretty accurate to the situation we're in today. The novel coronavirus, we do not have any therapeutics that we know for sure work. We do not have a vaccine. There's been some talk of a antiviral, remdesivir, and there's been lots of news reports about this, but it still hasn't been concrete evidence that this is going to be fully effective in the treatment of COVID-19.
Are you concerned that the CDC faces a credibility issue here after the perceived overreaction to H1N1?
I'd rather the news story be that we overreacted and that many people lost their lives because we didn't do enough. That's why we're here today.
Does that news conference sound really familiar to you? Well, because an interview just like that took place with Dr. Fauci in mid-March. I'm going to play it for you right here.
I might make a point that people sometimes think that you're overreacting. I like it when people are thinking I'm overreacting because that means we're doing it just right.
So the problem is that you can take these extreme measures and they may actually work and lives may be saved, but when nobody's dying because the measures actually work, then everyone looks back and says, wow, you're overreacting. And so these interviews are pretty spot on. So what these two are wearing here is personal protective equipment, also known as PPE. I'm very impressed by this movie of how accurate they are down to these little details, like the PPE that these two are wearing, which is the full body gown. They also have the N95 masks, as well as a hair covering. I would say that my one criticism here is that they aren't wearing any eye protection, any goggles or eye shields.
We are heading toward 267,000. And from there, using our model based on an R naught of 2, here is where we expect to be in 48 hours.
So what's a little bit creepy about the scene is that I remember looking at the Johns Hopkins data tracker. If you saw that map, that looked very similar. That was tracking all the cases around the world. Back in February, all the cases were in China. And now you see the map and it looks very similar to that map that was shown.
Okay, we'll put the airlock here. I want 25 rows, 10 beds apiece. The most febrile cases at this end. We'll set up triage outside. FEMA can handle food in the basement. And we'll need to be operational within the next 24 to 48 hours.
So this movie is pretty accurate because here in New York City, the same thing happened. We were so worried about the surge of patients overwhelming the hospital system. And we know that's when lots of patients die. Lots of field hospitals and temporary hospitals were being built out here, and they actually used the convention center, the Javits Convention Center, to build out a temporary hospital with hundreds of beds. And that hospital actually treated about 1,200 patients. And fortunately, the surge has actually kind of died down in New York City, and they were actually able to close that hospital pretty recently.
No, don't open the door. Don't open the door.
It's Andrew.
Sorry, Andrew. I can't let you in.
I just came to give my condolences, Mr. Emhoff.
I understand. Thank you. But I can't let you in.
This is one of the sad parts of social distancing, and I think this movie portrays it pretty accurately, is that human beings, we are very social in our nature. And this has been one of the hardest parts of doing effective social distancing, is that we cannot touch or see our loved ones.
I'm immune. I've already had it. And my daughter's not sick. She's sick. She's not. No, we're just trying to get to Wisconsin. Border is sealed. The governor has declared a quarantine. Get back in your car. No.
Scenes like this, fortunately, are not happening. There are stay-at-home orders throughout the country right now, but no borders of states have been sealed. Roads are still open. Airports are still open. Train stations are still open. And that's to allow essential workers and frontline healthcare workers to move around and get to where they need to be. And thankfully, we did not implement any sealed borders because we'd have chaos like this.
Security is telling the CDC not to make any announcements until stockpiles of the drug can be secured.
Sanjay Gupta.
There continue to be evaluations of several drugs. Ribavirin is among them.
This is a little creepy because during this pandemic, I've definitely seen lots and lots of interviews by Dr. Sanjay Gupta on CNN. He's excellent, and I'm sure you have too as well. It's kind of crazy he's in this movie doing interviews with the CDC director.
But right now, our best defense has been social distancing. No handshaking, staying home when you're sick, washing your hands frequently.
I 100% agree with Laurence Fishburn here. We all need to stay at home, continue to take care to protect our families, guys. At some point, I think these scenes would have been creepy, but they're kind of not because they're actually happening right now. We know that there's empty office buildings, there's empty gyms, no public attractions are really open. I know there's talk about opening up the economy and starting to open up certain things, but these scenes are actually playing out in real life today.
The Food and Drug Administration is accelerating approval of the MEV-1 vaccine currently in production at 5 secret locations in the U.S. and Europe, saying the first doses could be available for human use within 90 days.
So a vaccine, guys. A vaccine is definitely what we need for COVID-19. As a physician, when we had that vaccine, that is the day I'm going to sigh a big sigh of relief for the safety of my patients, for the safety of my family and myself. And that's what we're hoping for. And the race is on right now. I know there's lots of companies, pharmaceutical companies out there working for a vaccine. Unfortunately, the experts are saying that it's going to take anywhere from 12 to 18 months to develop an effective vaccine that's safe. The fastest we've ever developed a vaccine was for mumps, and that took 4 years back in, I believe, the 60s or 70s. Now, hopefully medical technology has advanced tremendously since then, so hopefully we'll get to that vaccine faster.
We shall now begin the drawing. Gun. First MEV-1 vaccination are those people born on March 10th.
So this is pretty interesting on how they're deciding who will get the vaccine first. And I'm sure that will be up for debate once the vaccine arrives for COVID-19. I just hope that whatever way we distribute the vaccine, it's fair and equitable, and that it doesn't get determined based on your socioeconomic status or your ability to pay. This vaccine needs to be available for everyone. This is a pretty interesting portrayal of a post-virus world, right? Where you see all the disinfecting going on in the food court, and when Matt Damon walks into a public place, his wrist bracelet is getting scanned. Bracelet may contain information that he is immune to the virus and safe to be in a public place. And actually some countries like China and South Korea are using QR codes already on phones that contain information about that person, about whether they're immune to the virus or whatnot. Problem with that also is that, yes, you can track lots of people in this method, but there's also an invasion of privacy. So there will be debates to come on how we track that type of information here in the United States. So as you can see here, the vaccination is being distributed on a large scale in these stadiums to the entire population. And so this story has a happy ending. This movie has actually been super accurate in predicting so many things that happened during this COVID-19 pandemic that I certainly hope that the happy ending that is portrayed here plays out in real life for us and that we get this vaccine developed as soon as possible. I hope you guys enjoyed this reaction video. I know that it's getting really tough staying at home for the past 6 weeks, 8 weeks, and I know you guys are all hanging in there. This virus has not gotten any less deadly in the last 6 to 8 weeks, although we've all worked really hard to stay at home. I hope that you guys take care, take caution to protect your loved ones and also our frontline healthcare workers and all the essential workers who are sacrificing out there for us. Thanks again for watching. Please hit the like button below, subscribe below if you enjoyed this video, and I'll see you on the next one.